I'm going to talk about metabolic syndrome, and this is very important in risk reduction. And I would also demonstrate case studies. Metabolic syndrome consists of 5 criteria: the waist size, blood pressure 130/85 or higher, glucose between 100 to 125, triglyceride greater than or equal to 150, or low HDL in men less than 40, in women less than 50. If you have any 3 of the 5 criteria, it will meet the criteria for metabolic syndrome. In 1989, Dr. Gerald Raven at Stanford University identified syndrome X, which subsequently became metabolic syndrome. He identified clinical features that lead to recurrent cardiovascular event. Let's talk about the first case study. This is a 57-year-old man who was a former CEO. He doesn't smoke. He did struggle with weight, and he did enjoy playing golf and walk the dog. He does not know much about the father side of the family. The biological father left the family early. His brother is overweight. The maternal family history, there is history of premature heart disease. He came for an annual physical. His physical examination, he was 6 feet 2 inches and 220 pounds. His waist size was 41 inch. Blood pressure 150/88. His pulse rate was 64, respiration rate 12 per minute, and the cardiopulmonary exam was normal. His medication, including sildenafil 50 mg as needed and lisinopril 10 mg a day. Laboratory data included total cholesterol 220, HDL 36, triglyceride 220. His fasting glucose was 120. What is your diagnosis? Clearly, he has hypertension and hyperlipidemia. However, the most important diagnosis to make is he had metabolic syndrome, with 5 out of 5 the criteria for metabolic syndrome. This gentleman had waist size 41 inch, blood pressure 150/88, fasting glucose 120, a triglyceride 220, and an HDL of 36. The patient had all 5 criteria of the metabolic syndrome. What is the appropriate treatment? Of course, vigorous blood pressure control for blood pressure elevation, cholesterol medication for hyperlipidemia. He also needs lifestyle modification with exercise and diet. Who is this person? This is Bill Clinton. Look at his belly. Look at Newt Gingrich and his belly. Metabolic syndrome cross political line. In metabolic syndrome, the central physiology is increasing abdominal fat, therefore leading to waist size, low HDL, high triglyceride, fasting glucose elevated, and eventually blood pressure elevation. Too much food or the wrong kind of food. Again, the wrong kind of food and inactivity, watching too much TV or playing too many computer games. Abdominal obesity is the clear pathophysiology of metabolic syndrome. The upper CT scan show abdominal fat. The lower CT scan show subcutaneous fat. The abdominal fat sucks up the action of the insulin, leading to insulin resistance. And it leads to inflammation and therefore accelerated atherosclerosis, again, the 5 criteria of metabolic syndrome: waist size, blood pressure, glucose, triglyceride, and low HDL. Metabolic syndrome lead to cardiovascular morbidity and mortality. In this finished data set, patients with metabolic syndrome had 3.55 times the mortality of patients without metabolic syndrome. My own aggressive treatment of cardiovascular disease began with the 1994 4S trial, the Scandinavian simvastatin survival study that showed taking simvastatin had tremendous mortality and morbidity benefit. 1998, I began to treat metabolic syndrome very aggressively at the office. In the metabolic syndrome patient in the 4S trial, patient on cholesterol treatment had 48% reduction in cardiovascular risk. I also advocate exercise, 30-minute walking exercise. Walking exercise is associated with close to 60% reduction in new onset diabetes, versus taking medication metformin is associated around a 30% reduction in new onset diabetes. If the person had both metabolic syndrome and high blood pressure, how should that person be treated? The answer is treat both the blood pressure and also treat the lipid early, then you will reduce cardiovascular risk. The data for treating both blood pressure and lipid aggressively early come from the Mr. Fit data from the 1980s. For instance, if both your blood pressure were high, say 145 systolic blood pressure, and your total cholesterol is 250, then your event rate is marked by 34. When your blood pressure was brought down to say 128, then from 34 you drop to 17. However, if you drop the cholesterol all the way to 170, you drop the event rate to 6, and thus you change from 34 per 10,000 to 6 per 10,000, a tremendous reduction in risk. The Mr. Fit data generate the hypothesis, and the proof was found in the ASCOT trial, ASCOT trial. In this particular situation, patients whose cholesterol were less than 250 with hypertension and extra risk factor, they were randomized to placebo versus atorvastatin 10 milligram. And in 3.3 years, the trial had to be stopped because there was 36% reduction in MI. Projected at 5 years, the reduction in risk was 50%. Note the slope of the curve diverged from the origin. Treating blood pressure is particularly important to prevent stroke. And when you treat both blood pressure and cholesterol early, you have tremendous power in reducing stroke morbidity. This was the handsome picture of Dr. Senator Mark Kirk from Illinois before he had the stroke. This is the picture of Senator Mark Kirk after he returned to work and rehab from the stroke. Look how much white hair he had on his hand. He cannot move his left hand and he's gesturing with his right. Treat metabolic syndrome and blood pressure aggressively to reduce stroke. If you have metabolic syndrome, it's important to think about treatment with treating the cholesterol and initiating exercise and diet early in the treatment. Let's look at another case of metabolic syndrome. This 43-year-old Asian American physician in 1997 had fasting glucose 106, HDL 31, total cholesterol 247, triglyceride 776. Blood pressure was normal at 110/70. Waist size 32.5 inch. And the height was 67 inches. He was treated with cholesterol medication and a exercise regimen, initially at least 30 minutes. Then eventually it became 30 minutes plus 10,000 steps a day. And he also initiated on a diet. The lipid on August of 2012 show a total cholesterol 142, HDL 56, LDL 64, and a triglyceride of 107. That was on a Crestor 20 milligram 1/4 tablet Monday, Wednesday, Friday, Sunday, and the CETIA 10 milligram half a tablet Tuesday, Thursday, and Saturday. Then the treatment was modified to include the 10,000 step DASH diet, sleeping 7.5 hours, and also doing yoga. This person, the weight dropped from 166 to 142 pounds, and the hemoglobin A1C dropped from 5.9 to 5.2. That person was me, and that was my story of treating my own metabolic syndrome. It began in 1997 to today. To recap, if there's metabolic syndrome, it's important to treat lipid, begin exercise, and also treat with a diet. If there's metabolic syndrome with hypertension, then it is very important to treat both the metabolic syndrome and the hypertension aggressively. Of course, exercise, 10,000 steps, and diet are also important as well.